a typical pattern I see here in the clinic for gastroenterological problems is the patient will have chronic aches and pains. They will go to the gastroenterologist. They will get scoped. And if it was an upper endoscopy and they have something like gastritis or GERD or acid reflux, they'll be prescribed a drug like pantoprazole or omeprazole and sent on their way. If it was a lower GI issue, they'll do a colonoscopy. Maybe there's a polyp or two. If the patient's a little bit older, they snip them out, and that's about it, and they send them on their way and tell them they're fine. Well, you can go to the gastroenterologist. What they're thinking about is, one, getting your symptoms under control, two, keeping you stable and safe. And the same is true of urgent cares and ERs, and that's how gastroenterologists are trained. They want to keep you stable and safe, and then once you are, they can refer out, and you can follow up with their physician assistant or whoever needs to happen. Ultimately, if it is a serious enough issue, then surgery is required. As a more holistic or a naturopathic gastroenterologist, I don't simply look at your gut. I look at the bigger picture. And for the functional issues, I would argue that it's better to see somebody who's going to be a little bit more holistic, who's going to ask why and get to the root cause of what's going on. It's not to say that you shouldn't see a gastroenterologist, and I refer out to many excellent ones. However, it might be something else. Now, if you're seeing blood and mucus in your stool, having extreme pain, you need to go to urgent care and get that handled. But for the more functional chronic stuff, there's usually a better explanation that's coming from a different organ system or coming from diet or lifestyle that we're going to address here in our clinic a little bit more effectively than they might in a gastroenterology clinic that's just looking down the specialty of the gastroenterological tract. Boy, that's a mouthful. So anyway, we really continue to ask why. We try to get to the root cause of what's going on so that we can work on that. And it is sometimes simple, sometimes it's complex, guts go up and down, but it's kind of good to have somebody who's looking at absolutely everything in your corner for that. If that sounds like something you need a custom solution for, go over to my website. It's drdanwool.com. In the meantime, fix your gut, solve your health.